CT is really a new diagnostic imaging modality that we can use as an alternative to what's out there on the market today. What CT is that no other modality has is that Koning Breast CT does a 360-degree shot around the woman's breast, and it acquires that in 10 seconds, which is amazing, and it does it without compression as well. So what it does is it gets rid of tissue overlap, especially in ladies with dense breast tissue, and we're able to localize these lesions in 3 planes, which the 3D allows us to do.
So the radiation dose for Koning is equivalent to a diagnostic mammogram as currently configured. And I believe the radiation dose is very important. We need to find cancer at the lowest possible dose. We need to work up patients with the lowest possible dose. So this is not an unimportant feature of this system. We shouldn't have systems that are high radiation.
The other imaging modalities require more radiation, and they do have dose to the critical organs. CT of the breast does not have any dose to the critical organs such as the liver and colon, so that's very important to note.
I have been very impressed with the quality of the Koning images. The images are very, very high quality and show cancers very well.
The image quality with CTs of the breast, it's exquisite because we take these very thin slices, very low-dose slices, and we reconstruct it after we do the 10-second acquisition. So in order to localize these small cancers, sometimes it's difficult with a 2D flat image. So we can take this 3D image and localize it in 3 planes, and it makes it much easier to see smaller lesions, which we can't with a 2D image.
The isotropic 3D imaging that Koning provides is an impressive feature. I think it will be helpful to radiologists in identifying the true location of known lesions once they identify a lesion, finding it in the other planes, or identifying that it's not really a lesion. So this is a positive thing for the system.
Also with image quality too, we're finding that with contrast with CT of the breast, this also enhances the image quality and the detection and sensitivity of finding these lesions. We've started doing a study, and actually have done several women with contrast, and found when we compared it to contrast-enhanced MRI, we found as many cancers with MRI as we did with contrast-enhanced CT. Moreover, we found additional cancers that we couldn't see with MRI with the contrast-enhanced CT. It will reduce the false positives, and it will reduce patient anxiety. And that's the whole point, is to find things and make it easier for the patient.
Women complain constantly about compression with mammography. It's one of the things they hate the most about it. I think that if we can provide a technology that has equivalent diagnostic accuracy without compression, that will be a huge bonus, and women will really want to use the technology. So I think it's important.
We can accommodate women who are a larger size, unlike other machines that can't accommodate the full-figured woman, and that's a problem. It can also accommodate women who have implantable devices such as pacemakers, and it can also accommodate women with anxiety and claustrophobia. These women can't go into an MRI scanner without a lot of difficulty and medication, and that's one big benefit of CT. And it's much quicker, anywhere from a 30-second study to maybe a 2 to 3 minute study. MRI takes longer. It's a 15 to 20-minute exam. It's a very expensive exam.
It's likely to fit into the diagnostic workflow, maybe replacing MRI in some instances, maybe replacing ultrasound in some instances.
It's very easy to put into a practice and fit into your workflow, which is the biggest problem because we have so many modalities out there now between MRI and ultrasound mammography. It's easy to fit in, it doesn't take long, it doesn't take up much space. We don't need a lot of shielding like you do with MRI, and the cost tends to be less.
It's a very promising technology. I believe that 3-dimensional imaging is likely to supplant 2-dimensional imaging sometime in the future. I believe it will be used.